Hello, and welcome to Disciplines and Ideas in the Applied Social Sciences. I am Armin Rose, and I will be your guide as we go through the concepts of this course. The first discipline we are going to study is counseling. This is part 2, the discipline of counseling. The discipline of counseling is a relationship characterized by the application of one or more psychological theories and a recognized set of communication skills appropriate to a client's individual concerns, problems, or aspirations. Counseling is the process of guiding a person during a stage of life when assessments or decisions have to be made about himself or herself and his or her life course. We need counseling when we are at the crossroads of our lives, when we have to make a major decision, or when we have a problem that is too much to handle on our own. As a discipline, counseling is allied with psychology and deals with normal responses to normal life events, which may sometimes create stress for some people who, in turn, choose to ask for help and support. Counseling is a non-clinical intervention. In traditional societies, counseling is provided by family, friends, and the wise elderly. Counselors exist in a wide range of areas of expertise: marriage, family, youth, student, and other life transitions, dealing with managing of issues of loss and death, retirement, divorce, parenting, and bankruptcy. Counseling is widely considered the heart of the guidance services in schools. In a school, counseling is usually done as individual or group intervention designed to facilitate positive change in student behavior, feelings, and attitudes. Counseling also utilizes appraisal and assessment to aid counseling by gathering information about clients through the use of psychological tests and non-psychometric devices. Counseling is not to be confused with psychiatry, which is a branch of medicine that deals with the treatment of the mentally ill by medically trained professionals using clinical intervention, including drugs, surgical procedures, and non-physical approaches. Context and the basic concepts of counseling. Context is a set of circumstances that form the setting of an event, statement, or idea, and in terms of which it can be fully understood and assessed. The primary context of counseling a client is the family. Other important contexts are peers, neighborhood, culture, and the counseling situation itself. Let us look at each of them one by one. The family as context. The family is the primary context in which a person learns, develops, and socializes. Parents have much influence over their children. Critical issues involve family roles, both positive and negative. In most cases, the family can help counter negative influences of the other context. The peers as context. The attitudes, norms, and behaviors of friends have a strong influence on adolescents. Many personal issues are often introduced to the individual by their peers. The neighborhood as context. The neighborhood is an important immediate context because the family and peers function within it. The problems in a particular neighborhood may require families to work together to solve them. A community network that collaborates in raising the children has an informal agreement of shared responsibility. The neighborhood can both introduce additional strengths or challenges to counseling. Culture as context. Culture is the source of norms, values, symbols, and language which provides the basis for the normal functioning of the individual. Understanding the cultural context of the client makes it easier for the counselor to appreciate the nature of their struggles as well as their cultural conditioning that informs on personal characteristics, such as degree of openness to share personal experiences, self-revealing, making choices, and personal determination for independence. Counseling as context. The counseling situation is itself a context, regardless of the therapeutic approach in use. There is a deliberate, specific focus. a set of procedures, rules, expectations, experiences, and a way of monitoring progress and determining results. Factors under the counseling context are the client, the counselor, the setting, and the process. Factors of the counseling context. The client factor. Clients are not passive objects receiving treatment. They should be considered an active participant. The expectations and attitudes of the clients define the result of the counseling. The success or failure depends on the client. The counselor factor. The counselor's personality, skills, and personal qualities can significantly impact the outcomes of the counseling relationship. The choices of methods that the counselor uses also determine the positive or negative experience of the client. Contextual factors. The environment and atmosphere where to conduct the sessions are also important. Ideally, counseling should take place in a quiet, warm, and comfortable place away from any distraction. Process factors. The process factors constitute the actual counseling undertaking. VELLEMEAN presents 6 stages which apply to all problem areas in the process of counseling. The 6 stages of counseling process. First is developing trust, then exploring problem areas, helping to set goals, empowering into action, helping to maintain change, and finally, agreeing when to end the helping relationship. The goals of counseling. Counseling is aimed at empowering a client. The general goal is to lead an individual or group to self-emancipation in relation to a felt problem. Self-emancipation. At some stage of the process, the client should attain insight and understanding of oneself, achieve better self-awareness, and look at oneself with increased self-acceptance and appreciation, and be able to manage oneself positively. Empowerment. Client empowerment means that they develop skills and abilities that require self-management and improved motivation towards actions that are good for oneself, and develop a positive outlook toward the past, leading to some sense of closure and attainment of relative inner and outer harmony, resulting to improvement in relationships with family, friends, colleagues, and others. The scope of counseling. The scope of counseling is wide. It involves application of some psychological theories and recognized communication skills. It does not deal with clinical cases such as mental illnesses. It is a professional relationship that requires an eventual closure and termination of the counselee-counselor relationship. Principles of counseling. Advice, reassurance, release of emotional tension, clarified thinking, reorientation, listening skills, respect, empathy and positive regard, clarification, confrontation and interpretation, transference and countertransference. Core values of counseling: respect for human dignity, partnership, autonomy, responsible caring, personal integrity, and social justice. The ethical principles for counselors. Counselors shall act with care and respect for individual and cultural differences and the diversity of human experience. Avoid doing harm in all their professional work. Respect the confidences with which they are entrusted. Promote the safety and well-being of individuals, families, and communities. Seek to increase the range of choices and opportunities for clients. Be honest and trustworthy in all their professional relationships. Practice within the scope of their competence, and treat colleagues and other professionals with respect. The ideas presented in this video are based on the content standard of the Department of Education and the book Disciplines and Ideas in the Applied Social Sciences by E.M. Sampa, published by Rex Publishing. Thank you for watching and see you in the next lesson.